Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Stroke Prevention Awareness, presented by Dr. Jack Rose, Neurointensivist with Washington Township Medical Foundation. Dr. Rose is an expert in neurointensive care and cerebrovascular disease and was among the first 100 physicians in the world to become board certified in neurocritical care. He is also board certified in neurology as well as vascular neurology. In early 2014, Dr. Rose was recruited by Washington Township Medical Foundation to augment Washington Hospital's comprehensive stroke and neurosurgical programs. He is now the co-medical director of Washington Hospital's stroke program. Please welcome Dr. Rose.
Thank you very much, and good afternoon. Welcome to our Facebook Live program, which is entitled Warning Signs and Prevention of Stroke. Stroke is a major health problem in the United States as well as the world. In the United States, there are almost 800,000 people who experience or suffer a stroke every year. It's the 5th leading cause of death in the United States. It used to be the 3rd leading cause of death, but we've made major strides over the last couple of decades to treat stroke so that it's less deadly, but it is still a leading cause of death in the United States. This translates to 1 person dying of a stroke every 4 minutes in our country. Even if you survive a stroke, there are a lot of affected people from stroke, over 5 million stroke survivors, and it is the leading cause of adult disability in the United States. It's also a very tremendous financial problem and tax on our healthcare system. It's estimated that stroke care exceeds over $30 billion per year in healthcare expenses. About 1/5 of people that experience a stroke are in some form of institution, either in a skilled nursing facility or a rehab center or an assisted living within 3 months after suffering a stroke. And up to 1/4 of people die within a year after their first stroke, with women having a slightly increased chance of dying than men. Unfortunately, only 50 to 70% of people that survive a stroke will regain their full functional independence, will be able to do everything they used to do before they had their stroke. And then certain groups of Americans have higher chance of dying from a stroke than others. For example, 50% African Americans have 50% more chance of having a stroke and it being more deadly than other ethnic groups like Caucasian Americans, and twice as often as Asians or Hispanic Americans. In terms of women in stroke, stroke kills more women, kills 2 times as many women per year than does breast cancer, which is a very common cancer in women. And like I mentioned before, more women than men slightly die from stroke. And which, in terms of which particular groups of women are at increased risk for stroke, well, it's especially prevalent, stroke is for women who smoke or take hormonal therapies. If you have the combination of being over the age of 30 and smoke and take contraception, it makes your stroke risk over 20 times higher than other women who do not have those conditions. Well, what is a stroke? Well, a stroke you can think of as a brain attack. As opposed to a heart attack, stroke is a problem that happens in the brain, not directly in the heart. And it's where a part of the brain either dies or stops functioning because of disrupted blood flow to the brain. Stroke is an emergency, just like heart attack is. And you should call 911 to get emergency evaluation and treatment if you are experiencing a stroke or you see somebody next to you experiencing a stroke. To tell you a little bit more about that, a stroke is caused when an artery that goes to the brain is either blocked or it ruptures, which either blocks blood supply to a portion of the brain or causes bleeding in or near a portion of the brain. And if that blood flow is disrupted for a particular period of time, the area of brain that normally gets blood flow from that disrupted artery can die or be injured, leading to a problem with that part of the brain's function. There are two main types of stroke. The most common type of stroke is a blocked artery stroke. We call these ischemic stroke. So 80% of strokes are ischemic, or from blocked arteries. That's when an artery that supplies blood flow to a portion of the brain becomes blocked, usually from a blood clot that's either from a diseased artery in the brain or the neck, or a clot that develops in the heart, for example, and then moves up to the brain artery and blocking that artery. And if the brain that gets blood flow from that blockage, the blood flow is not restored, areas of the brain can die from the lack of blood flow that brings oxygen and other nutrients to the brain. This is a cartoon diagram showing you what a stroke might look like. So you see these red tubes, these are the arteries coming up from the neck and giving blood flow to the brain, which is this large oval structure here. And you see in this enlarged area here, there is a red blood clot within a diseased artery in the brain. This is a middle large brain artery that's giving blood flow to a large region of this brain, but that has suddenly become blocked by this blood clot. And so areas of the brain that get blood flow beyond that blockage are at risk for permanently being damaged from the blocked artery. This is what an ischemic stroke might look like, and a fairly large one. In order to diagnose stroke, we use a number of imaging picture tests. This is what we call a CAT scan or a CT scan. It's a fancy X-ray technology that's been around for many decades, but still is very helpful in diagnosing and managing patients with stroke. And you see that this person has had a stroke affecting a small region of their brain. Normally, the brain tissue on a CAT scan should be gray, but if you see an area of blackness, that's an area of fluid where there was brain tissue there and there's no longer there. It's an area of brain loss that has occurred in the past. Now, strokes can be various sizes. This happens to be a relatively small blocked artery stroke. Someone might recover fairly well from a stroke of this size, although this is sort of more in the medium size, but strokes can be unfortunately very large as well. You notice this area of blackness, which is the permanently damaged area of the brain, is quite large. It's encompassing almost the entire half of this person's brain, and you see that it's causing swelling and pushing on the unaffected side of the brain, which is potentially life-threatening. The other main type of stroke is a bleeding stroke, or we call hemorrhagic stroke. That's when you don't have an artery blockage, but you have an artery breakage, where you have bleeding that leaves that broken artery and bleeds into the brain tissue itself or into the fluid spaces surrounding the brain. This is an example of what a small bleeding stroke looks like, with blood showing up as a bright white area in the deep part of the brain here, as opposed to the dark area you saw below. This is a relatively small area of a small bleeding stroke that someone might recover from, but would be very acutely sick from the beginning, but could recover from when that blood clot dissolves away and the disrupted brain goes back to its normal function. However, bleeding strokes can be quite large as well. You notice how large this area of abnormal whiteness is. This is a very large blood clot area of bleeding that is life-threatening. And somebody with a bleeding stroke of this size might not survive, even despite aggressive medical treatments or even brain surgery. What causes bleeding strokes? Well, there are three main reasons. The first one is a brain aneurysm. That's where you have a balloon or a large saccular blister on an artery that's present since birth and slowly grows over the decades and then can break. That causes bleeding into the fluid spaces of the brain. The other two main types of bleeding are just from long-standing high blood pressure, where small arteries break and lead to bleeding in the brain tissue. And then another major cause of bleeding strokes are breakage of an abnormal collection of arteries and veins that are connected in an abnormal fashion, and those are called AVMs, or arteriovenous malformations. This is a cartoon diagram showing you what an aneurysm might look like. You see these thick, dark red tubes here. These are what normal arteries look like in the brain, and you see that there's this round aneurysm, this blister that's developed, and then this is an area where the actual aneurysm will burst, causing blood to flow into the fluid spaces around the brain. This is a type of bleeding stroke that we actually have surgical treatments for. We can close off the area of bleeding by either putting a very small catheter directly into the aneurysm and filling it with metal coils, or if that's not possible for a number of reasons, we can do an open brain surgery where we open up the brain, carefully move it aside, identify the aneurysm, and place a metal clip at the base of the aneurysm. This is called an aneurysmal subarachnoid hemorrhage. We are a center of expertise for treating these types of bleeding strokes here at Washington Hospital. The more common type of bleeding stroke is not from an aneurysm, but a small breakage in a small artery deep in the brain where you have bleeding directly into the brain tissue. And we have less treatment options for this type of stroke besides controlling blood pressure and making sure any increased bleeding risk is well managed. We don't have a lot of surgical treatments for this type of bleeding stroke. AVMs we can also treat with surgeries, fortunately. What about anything that can warn you that you might have an increased chance for having a stroke, or that a stroke might be happening in you or somebody you know? Well, there is something called a TIA, or transient ischemic attack. They are not mini strokes, but what they actually are warning signs of a stroke. And these can precede or happen before an actual stroke occurs. And that's when you have similarly blockage of blood flow to a portion of the brain, but only for a brief period of time. And then the blood flow is restored and the brain function is temporarily only temporary. TIAs are therefore temporary, but similar to a regular stroke, but the symptoms resolve usually in seconds to minutes, not hours to several days. TIAs are also quite common, occurring in almost 250,000 people every year in the United States. And if you have a TIA, it is truly a warning sign that a stroke is much more likely to happen in the near future. In fact, if you have a TIA, you're almost up to 10 times more likely to have a stroke after experiencing a TIA, and that risk is highest in the first 30 days after having a TIA, or a warning sign of stroke. Well, what are the warning signs of stroke or TIAs? Well, it's when you have sudden numbness or weakness or other dysfunction of part of your body, especially if it affects one area of your body, one side of your body, or one particular function of your brain, like speech or language or vision. And as opposed to heart attacks, where most people know to recognize sudden crushing chest pain and difficulty breathing, most strokes, especially the blocked artery types, are associated with no pain. So it's sudden, painless inability to move part of your body, to feel part of your body, to be able to speak, to be able to understand language, trouble suddenly seeing out of one eye or out of one side of the world. It could also be sudden inability to walk in a coordinated fashion, or sudden unexplained dizziness or loss of balance. And if it's a bleeding type of stroke, sudden severe headache, unlike you've ever experienced before, without other causes, like somebody that knows they have migraines on occasion. So a sudden severe headache could be a warning sign of a bleeding stroke. But most strokes, the 80% type, are not associated with headache or pain. One way that you can remember the signs, warning signs or symptoms of stroke, is to learn this Be Fast mnemonic, which is a way that you can remember what the main warning signs or symptoms of stroke are. B is for balance, so if you suddenly are unable to be balanced or to walk without coordination, that is a potential warning sign of a stroke. E is for eyes, so if suddenly you can't see out of one of your eyes, or suddenly you can't see one side of the visual world, that could be a symptom of a stroke or warning sign of a stroke. F is for face, so suddenly if you don't feel one side of your face, or your face becomes drooped and and that is a new, different thing for you or somebody that's near you, that could be a warning sign of a stroke. A is for arm, so if suddenly your arm becomes weak or you can't feel your arm on one side, that is a symptom of stroke. S is for speech, so if somebody's speech suddenly becomes slurred or not intelligible, or they can't, they're using the wrong words all of a sudden or can't speak at all, then that could be a symptom of a stroke. And then T, the last letter in be fast, is for time. Stroke is a medical emergency, and you want to be fast by calling 911 as soon as possible. If you suspect somebody having a stroke, or you yourself may be experiencing a stroke or a warning sign of the stroke. And then the other thing to remember, like I've said before, is that stroke often affects one half of the body more than the other. So most things in the brain are crossed in terms of the brain and the body. So if you happen to be experiencing a stroke in the left side of the brain, it would impair the right side of your body function. So a left brain stroke would potentially cause weakness on your right side of your arm or your leg or your face, or sometimes it can be crossed, one side of the face, the other side of the body. Also, most people have language function on their left side of the brain. So if you have problem with your left side of the brain blood flow from stroke, you might expect to have language problems. Whereas on the right side of the brain, if the right side blood flow to the brain is disrupted, you would expect to maybe have problems with the left side of your body. Your left side of the arm or the leg may be weak. And you may not really fully understand that you're having these problems, because the right side of the brain is much more involved in understanding of the world around you and your own body function, to be able to be aware of how well you're doing things, as opposed to language. In order to look for signs of a stroke, especially after you call 911, the paramedics or other EMS professionals will oftentimes do 3 tests to look for signs of stroke. And they will look for signs of facial drooping, arm drifting, and then speech trouble. In order to see if somebody is having problem with their face, yourself by looking in a mirror, or with someone that's beside you, you can ask them to show them your teeth or smile, or you can try to do that yourself in a mirror. And normally you should see both sides of the face move normally, both corners of the mouth raised symmetrically. However, if there's a potential stroke happening, you would expect only one side to move. So this is an example of somebody's face where, asked to smile, you see that the right corner of his mouth stays down and doesn't move up like the other side. So this is evidence of a right side facial weakness. In terms of arm weakness, one way you can look for somebody having potential weakness of one of their arms is to ask them to raise both of their arms. And to keep them raised, and with their eyes open at first, and then also with their eyes closed. And if both arms are able to be held out for, say, 10 seconds, then that's a sign that there's no arm weakness. But if one of the arms is unable to move or drifts down, either slowly or quickly, that could be a sign of weakness of one arm, which could be a symptom of stroke. This is an example of a woman that's asked to hold up both of her arms and then close her eyes, and she's unable to hold that right arm up. So that's a sign of some mild arm weakness on that right side. And then in terms of speech, one way you can get at whether somebody's having a speech problem, which may be a symptom of a stroke, is to ask them to repeat a sentence. Something like, "The sky is blue in Cincinnati." And normally someone would be able to repeat this sentence or any other sentence in their preferred language without slurring, without word substitutions, and that it's easily understandable. However, if the words are slurred, wrong words are substituted for the words, or they can't repeat the sentence at all, that could be a sign of some part of the language part of the brain not getting blood flow from a stroke. So if you suspect stroke in yourself or your family member or a bystander, somebody that's next to you, or friend, you don't want to wait and see if it gets better. You want to call 911 right away to get evaluated and brought to a local hospital. Because time lost is brain lost. So the faster we can identify and diagnose a stroke, the faster we can potentially give you brain function-saving treatments and even life-saving treatments sometimes. So it is a medical emergency, and you really need to call 911 if you ever suspect that you or a friend or a family member or a bystander is having a stroke. We do have treatments for strokes. In fact, one of the big treatments that we have is something we can give a clot-dissolving medicine. It's called TPA. So remember I showed you that most strokes are caused by blood clots blocking arteries. Well, if somebody gets to a hospital within the first 4.5 hours after the stroke has started, or that we last knew that the person was normal without their new problem, we can potentially give them this clot-dissolving medicine, and it significantly increases the chance for them to recover as well as possible from their stroke. But we can only do this within the first several hours after the stroke began, or the person was last seen without their problems. And we try to give this drug as fast as possible once somebody has come into the emergency department. This drug, TPA, cannot be used for bleeding strokes. In fact, it's the last thing that you want to do for a bleeding stroke. We have other things that we can do for bleeding strokes. We can also sometimes treat ischemic strokes by giving this medicine and following it up with a procedure in the brain catheter lab, where we can sometimes do a procedure to pull out large clots that are blocking brain arteries, and that we can sometimes do up to 24 hours after the stroke has started. But still, the fastest you can identify that large artery blockage and treat it either with medicines or a surgery, the much better the chance for you to recover your important brain function is. After you've suffered a stroke, we can also figure out why it happened to you and what medicines we can give you to prevent future strokes or warning signs of strokes. And this would include various medicines to thin the blood a little bit, to treat high cholesterol level, to treat diabetes. Sometimes we actually have to do a neck surgery if we think the stroke is caused by a artery narrowing in the neck. That's called a carotid endarterectomy. And sometimes we also can do devices with balloons and stents in brain arteries themselves to open up narrowed areas of the brain if somebody is continuing to have stroke symptoms despite being on the most optimal medical therapies. For bleeding strokes, can we treat them? Well, it depends on the type. Like I mentioned, bleeding strokes can be caused by aneurysms or small artery blockages or vascular malformations like AVMs. Aneurysms and AVMs can be treated surgically. The smaller artery bleedings cannot and are treated medically for the most part. But neurosurgeons that are expert in vascular disease are available at most stroke centers, and including ours here at Washington Hospital. And some of the bleeding strokes, for example, the aneurysms, can be treated without a big open brain surgery. They can be treated with minimally invasive techniques with tiny little catheters in a very eloquent and well-tolerated minimally invasive surgery. Washington Hospital is a very high-quality primary certified stroke center. We have been so for many years, and we're certified on a bi-yearly basis by the Joint Commission, and we follow a lot of high-quality best practices with the national and international guidelines. We also have a very strong rehabilitation program, starting from when patients are in our hospital and then after discharge from the hospital, before or after they're discharged home. And rehabilitation is a very important part to stroke care, to get people to be able to function as best as possible. We have physical therapists, occupational therapists, speech therapists, and a whole range of different rehab programs, either inpatient or outpatient, or even based in your own home. What are the risk factors for stroke? Why would somebody have a stroke? Well, there are some things that you can't modify or change. If your age is a big risk factor for stroke. So as you age, it increases your risk for stroke. Women and men are affected by stroke fairly similarly, but women are slightly at increased risk for dying after having a stroke. And then there are some genetic factors and ethnicity factors that might increase your chance for increased stroke. That's mostly because it contributes to other diseases that are associated with stroke, like, for example, high blood pressure or high cholesterol. And then your history, your past medical history. If you've had a stroke in the past, it increases your chance for having a stroke in the future. So those are the things that you can't really do anything about. However, there are many more things that you can do to modify your risk for stroke and to lower it as low as possible. Because the biggest risk factors for stroke are such as these. High blood pressure. High blood pressure is probably the biggest risk factor for both blocked artery strokes, and bleeding strokes. So if you have high blood pressure, you should really work with your doctor or other healthcare provider to make sure that your blood pressure is treated with medicines and other lifestyle factors so that it's well treated in the normal range. If you happen to have high cholesterol and you're at risk for stroke, you want to do lifestyle modifications and potentially use medicines to lower the cholesterol level to normal levels. Smoking is a very large risk factor for stroke. And fortunately, we've made a lot of strides in the United States by minimizing the number of people smoking. But if you do smoke, you really should try to absolutely stop because it increases your risk for stroke significantly, together with heart disease, heart attacks, and cancer. Atrial fibrillation is a heart arrhythmia, a funny heart rhythm that affects mostly people that are in their 70s and older. And it's where the top chamber of the heart, instead of beating regularly, it quivers at times. It can quiver all the time or just occasionally. And when the top chamber of the heart quivers, as opposed to beating nice and regularly, blood clots can form in that quivering part of the top chamber of the heart, and those blood clots can then go up to the brain and cause large blocked artery strokes. So if you have atrial fibrillation, whether you have it all the time or intermittently, you should be on some blood thinner medicines to prevent these clots from developing and to protect yourself against future stroke. Heavy alcohol use is another modifiable risk factor that is both significant for blocked artery strokes and bleeding strokes, and so we recommend that people abstain from alcohol or only use mild amounts. Diabetes is not listed here, but it's another very modifiable risk factor that significantly increases your risk for stroke, and so treating your blood glucose, so avoiding very high levels of blood sugar, is very important to minimizing your risk of stroke in the future. So the most important thing is, even though we can treat stroke, we want you not to have to treat the stroke. We want to prevent stroke from happening in the first place. So make sure that you follow up with your doctors to make sure your blood pressure is well treated, to make sure any medical illnesses that you have, like high cholesterol or diabetes, are managed very well. You want to make sure that if you do have high blood pressure, to follow the numbers at home and keep a record of it and bring it to your doctor so they can help you control it. You want to make sure that your weight is as healthy as possible. Obesity and sleep apnea are two weight-related stroke risk factors as well. So you want to eat healthy, you want to exercise regularly, and stop smoking and don't drink to excess. So these are some of the controllable risk factors that you want to do. And also, sedentary lifestyle has been shown to be one of the risk factors for stroke, as well as heart disease. And so you really want to keep yourself both physically and cognitively active. So what we've reviewed about stroke today is that it is a common major health problem in the United States. It unfortunately can be lethal, could also disable your brain function, but fortunately, excuse me, you can detect the signs and symptoms of stroke early, call 911 to get rapid medical attention, because most forms of stroke are treatable but need to be treated as soon as possible. Time is critical. It's a medical emergency. So you want to know the signs and symptoms of stroke. You want to remember this be fast mnemonic. So if you suddenly have numbness on one side of the body, you suddenly have weakness on one side of the body, you suddenly have trouble seeing out of one of your eyes or in one side of the visual world, sudden trouble speaking or using language or understanding language, sudden trouble walking in a coordinated fashion, sudden loss of dizziness of your balance or dizziness or the world spinning around you could be a sign of a stroke. And whereas most stroke symptoms are not associated with pain, if you have a bleeding stroke, you might have a sudden severe headache unlike you've ever had before that you don't expect. So if you suspect a stroke, remember, don't try to self-diagnose yourself. Don't try to drive yourself or have a friend or family member drive yourself to the hospital. You want to call 911 immediately to be brought to a hospital like Washington Hospital and get evaluated as quickly and treated potentially as possible. So again, to review the Be Fast mnemonic, you want to watch out for sudden problems with your balance, sudden problems with your eyes or your vision, sudden problems with facial drooping or facial sensation, sudden trouble of weakness of your arm or leg, speech problems, sudden slurred speech, or inability to use language or understand language. And then T is for time. You want to make sure that you be fast and call 911 right away. To learn more about stroke, you can visit our website at Washington Hospital about our stroke program, or the Stroke Association, American Stroke Association website that you see here, or call 1-888-4-STROKE. And lastly, we can while stroke is treatable, we hope that you never experience a stroke, or that your friends or family never experience a stroke. So know how you can prevent or minimize the chance of you ever having a stroke to begin with. And the other thing about preventing a stroke is that all the same things that are very good things to do to prevent stroke will also keep your heart healthy and keep your body healthy as well. So thank you very much for watching this program, and I'd be happy to take any questions.
Okay, thank you, Dr. Rose. We do have a couple questions. The first question is, I have family members who have experienced a stroke. Am I more likely to have a stroke myself?
That's a good question. If your family members have had a stroke, you are slightly at increased risk, but not directly. Oftentimes it's because certain medical conditions like high blood pressure or high cholesterol or other diabetes, for example, can run in families. And so those are contributing factors to stroke risk. And so if other family members have had a stroke, it's likely that they may have had one or some more of these conditions that you might also have as well. And so knowing not just that your family members had a stroke, but what that family member's own stroke risk factors are, so that you can look for them in you and modify them to minimize your own risk for stroke.
Okay, thank you. And our next question is, does vaping contribute to conditions that can cause a stroke?
We do think that vaping is a risk factor for stroke, similarly to smoking cigarettes. Vaping obviously hasn't been around as long as smoking cigarettes, but we think that any kind of inhaled smoke on a regular basis in the lungs is injurious to the blood vessels in the body. And so we think that vaping is probably just as bad as smoking cigarettes. There may be less, perhaps, of cancer risk with vaping as opposed to smoking cigarettes. However, in terms of heart disease and stroke, we think that vaping is probably just as bad for you as smoking cigarettes. So we would recommend against vaping to any degree for anybody, and especially those people that have other factors increasing their chance for stroke.
Okay, and our last question is, if you're having a TIA or stroke symptoms that resolve quickly, do I still need to go to the emergency room?
Yeah, so if you experience some symptoms that could be stroke related, but they get all better, that could be what we call a TIA, or a warning sign of a stroke. And so even if things get better, you still want to call 911, because like we mentioned, one of the biggest things about TIAs is they can precede an actual stroke. And you want to get evaluated as soon as possible, so that we can look for reasons why you had that warning sign. We want to look at your blood pressure. We want to look at your blood vessels in your neck and your brain. We want to look at your heart. We want to measure your heart electrical activity to make sure you don't have heart arrhythmias. And so even if you have these symptoms for minutes to a few hours and then get all better, you should go to medical attention, still call 911, and get evaluated as soon as possible.
Okay, thank you. This does conclude our program. Thank you, Dr. Rose, for being here today for this insightful presentation, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.